Hi, welcome back to Student Nurses Success, where we're continuing to talk about our cardiac problems. This particular map is going to cover cardiac valve problems and specifically mitral and aortic valves. Those are the two that we find most commonly affected in adults, so those are the two we're really going to focus on. Let's not waste any time and let's go ahead and get started. Remember, you can find the link to the maps in the comment section. What is important is that we first talk about anatomy. If you understand where these valves are located in the heart, then you can troubleshoot and identify what the manifestations are going to be when these valves are not working properly. Again, let's start with the mitral valve and the aortic valve because those are the two valves that we're really focusing on. The mitral valve is located between the left atrium and the left ventricle on the left side of the heart, which is the main pumping chamber of the heart. If you look at this picture that I have in the middle of the map, you can see right here is where the mitral valve is. When the mitral valve is not working properly, if it's either too floppy and leaking or it's too tight, what we're going to see is blood backs up into the left atrium and backs up into the lungs. Now, your aortic valve is located between your left ventricle and the aorta. So in the picture, it is right here. When that aortic valve is not working properly, we start to see blood back up into that left ventricle, which then backs up into the through the mitral valve into the left atrium and then back into the lungs. Additionally, what we're going to see if that aortic valve is not working properly, we do see a decrease in cardiac output out to the body, which is going to be problematic. The tricuspid valve is over here on the right side, and the pulmonic valve is between the right ventricle and the lungs. We're not going to talk about those two in this video. Those two valves actually tend to be problematic in congenital heart defects, but they tend to not cause problems as we get older. Couple other things we need to talk about with regard to definitions. The first is the definition of regurgitation. Regurgitation means floppy valve. If your valve is regurgitating, that means it's not very strong and it's actually leaking, and blood is going both forward and backward through it when it closes. You can see in this picture right here how the valve is not closing tightly. So this particular valve is probably regurgitating or leaking. Should we just right here, leaky valve. Valves should close very tightly. Now, a prolapse is when the valve is ballooning or stretching into the chamber when it closes. So it is weak, but it is still closing. Eventually, a prolapse will actually turn into a regurgitation after the valve becomes so weak. Stenosis means that it's tight and narrow. So it's the opposite of regurgitation. It means that there's decreased flow going through the valve. This can result from aging or calcification. You can be born with stenotic or tight valves, but in most adults, it's the result of the aging process or calcification. Now, when a patient has a heart murmur, it means that usually there's turbulent flow going through the heart, and it usually means that the valve is either leaking or stenotic. So, the assessment piece that we notice in valve problems is murmurs. In health assessment, you were taught to listen to the heart in the five locations: the pulmonic, the aortic, the tricuspid, and the mitral area. And that's because in each of those areas, you would actually hear that valve the best. So let's move over to our picture here with the stars. This first star right here is the aortic area. And when you listen to the heart, if there's an aortic valve problem, you will hear that murmur best when you listen there. We look at this second star, this is what we call the pulmonic area. And you would actually listen and hear a murmur in that particular area the best if there was a pulmonic valve problem. This middle spot here is called Erb's point. And then right here, was your tricuspid area, and this one right here is your mitral. And again, you would hear your mitral valve problems best in that location. That's why it's important to assess the 5 areas. I think we're ready. I think we're ready to talk about mitral valve problems and aortic valve problems. And let's begin with the mitral valve. With mitral valve problems, you can have mitral valve stenosis, mitral valve regurgitation, or mitral valve prolapse. But basically, if you're talking stenosis or regurgitation, you're talking about the same physiological issue, and that's that blood is going to back up. If the valve is tight and stenotic, then blood can't get through it and blood's going to back up into the left atrium. If the valve is regurgitating, meaning it's floppy and not closing tightly, when it tries to close, blood's still going to back up into the left atrium. So in both cases, the backup is into the left atrium. When the blood backs up into the left atrium is not very big. So it can't hold all that blood. And so what we see is a backup into the lungs. And we also see a stretching of the left atrium that will occur. Now, these two physiologic issues here are going to really lead us to our manifestations. So manifestations of mitral valve prolapse, mitral valve stenosis, and mitral valve regurgitation are all going to lead to these symptoms. The backup into the lungs is really our most prominent problem, and patients will develop shortness of breath, dyspnea, or difficulty breathing. We start to see some pulmonary edema, crackles, and lung congestion. So when we listen to their lungs, they're going to sound very wet and moist because of that extra blood that's backing up into the pulmonary circulation. What you also might notice is the development of atrial fibrillation. From the stretching of that left atrium, it actually starts to distort the electrical pathway. Now, certainly, if you're going to have a backup of blood into the lungs and the left atrium, it does reduce your cardiac output. So we do see a decrease in cardiac output as well. This decrease in cardiac output can cause angina or chest pain because if you're not putting out enough blood, then you're not perfusing those coronary arteries. You also may see fatigue from the decreased cardiac output, a decrease in blood pressure, a decrease in tissue perfusion to the whole body, including the renal system, and maybe even capillary refill changes. Your capillary refill gets prolonged and decreased pulses. But with mitral valve problems, I will say the biggest issue is the backup to the lungs is the most prominent symptom that you will see. That's our biggest problem. Now let's talk about aortic valve problems. With aortic valve problems, with stenosis or regurgitation, we have the same issue going on. There is still a backup. If it's too narrow, then blood can't get through it and it's going to back up into that left ventricle. And if it's floppy, blood's going forward and backward through it and still backing up into that left ventricle. Eventually, that left ventricle gets too full and it starts to put pressure on the mitral valve. And that increased blood and pressure on that mitral valve will eventually ruin the mitral valve. So, patients with aortic valve problems eventually develop mitral valve problems because of the backup into the left ventricle will ruin that mitral valve. And then once that mitral valve is ruined, we start to see a backup into the left atrium and the lungs. Now, the manifestations of aortic problems are more prominent in the decrease in the cardiac output. That's actually our bigger issue with that. That left ventricle can actually hold a decent amount of blood and tolerate that. But what is really prominent is this decrease in cardiac output that we see. Patients with decreased cardiac output can experience angina from the decreased coronary artery perfusion, fatigue, decreased blood pressure, decreased tissue perfusion to the body, decreased pulses. And eventually, that backup into that left ventricle will ruin that mitral valve and back up into the lungs, and we will start to see the shortness of breath, pulmonary edema, crackles, and lung congestion. But again, our most prominent problem here is the decrease in the cardiac output that we see with aortic valve problems. So, with mitral valve problems, you see that back up to the lungs as your biggest issue. And with aortic valve problems, you see this backup, or I'm sorry, this decrease in cardiac output as your main issue. And there you go. We have simplified mitral and aortic valve problems for you. Remember to like and subscribe to our channel to keep up on all our new videos. Have a wonderful day.